The numbers don't necessarily justify an urgent care center being open 24/7. You know, what we have heard from Saskatchewan patients, particularly in the Regina area, and then residents of cities like Saskatoon and North Battleford, Prince Albert, Moose Jaw, people want urgent care services in their community. And so what our focus has shifted to, instead of focusing just solely on staffing up one facility at 24/7, our focus has now shifted. We want to staff and open up more facilities right around the province, right? When we look at the numbers of the presentations at both Regina General and Regina Pasco emergency rooms overnight, the numbers don't necessarily justify an urgent care center being open 24/7. So in a time of limited staffing resources, we want to focus on where it's going to have the greatest patient impact. Those are those daytime hours, those 8 a.m. to 9:30 p.m. We think the same is true both in Saskatoon as well as the other 3 communities we've talked about where we're going to be opening urgent care centers. So that's really our focus.
The 24-hour is not a priority, it's not a thing. This is not going to be 24 hours.
You know, listen, if there's an opportunity to go 24/7 at some point, that's certainly something we would look at. But we've also taken a close look at what urgent care services look like in other provinces across the country. Not all urgent care services across the country are 24/7.